Hello, I'm Dr. Mitchell. So you got yourself into a little bit of an accident. Why don't you tell me what happened? Okay, so you were riding your bike on campus and you fell. Did you fall into anything? I see that you have cuts on your face and you're doing compression, which is good, but what exactly? Oh, okay, I know exactly what you're talking about. That concrete barrier near the stairs. Yikes. Okay, well, no problem. We can get you fixed right up. Alright, and how much bleeding was there? Do you know about how long it took for the bleeding to stop? About 8 to 10 minutes, okay. That should be fine. Of course, I see the majority of your injuries are right around your nose, but internally, did you experience any nosebleeds? No? Very good. Have you felt any dizziness or lightheadedness? No. Excellent. Now, just from looking at you, I would say nothing appears broken. How much pain would you say you're in? So it's not excessive. Very good. Oh no, yeah, I understand. I know that had to hurt. Poor thing. Well, don't worry. That takes care of that. I'm gonna have you lie back now, okay? Just try and relax. And I'm gonna take a look and get everything fixed up, okay? Yeah, you can just keep your hand there for now. Alright. Let me see what we've got here. You can put your hand down by your side now. Perfect. Okay. Nothing looks too severe. Sometimes things can bleed and bruise pretty badly without being very serious, and luckily for you, I think that's what we have here. By the look of it, the worst is this laceration on your nose, and the rest appear to just be abrasions. And the laceration on your nose, that's not going to require stitches, so that's good news, yeah. I'd say this easily could have been a lot worse, but it's not too bad at all. Alright. I'm going to clean the area around the laceration on your nose first, but I'm not going to touch the wound, so don't worry. You really shouldn't feel any pain, and I'll be extra gentle, okay? Let me just get some of this cleaning solution. And a sterile wipe. Alright, now just lie nice and still for me, okay? You can close your eyes if it helps. I'm just going to clean around it very gently. I'm going to try to clear the area of this blood and dirt before I try to treat it. But it's not bleeding anymore, so that's fantastic. Does that hurt? Very good. Alright. Let me get around both sides. Take one more pass. Alright, just relax. Alright, it's getting nice and clean now. Like I said, this isn't going to require stitches, but I'm going to apply a mild local to the area. It'll numb it a little bit. Okay, there you go. And that way, when I numb it, you won't feel any pain when I'm sealing the wound. So let me do that now. Okay, get an applicator here, and I'm just going to get a little bit of this cream. Alright. And I'm just going to apply this to the edges of the laceration. And it'll get it nice and numb for you, okay? Just going to be very gentle. You might feel a little bit of stinging, but that should subside immediately. How's that? Good. Just lie still and breathe nice and deep for me while I make sure I apply this everywhere I need to apply it. Okay, I'm going to dab a little bit more over here, and this will take effect fairly quickly. Alright. I'm done with that, and while that's setting in, I'm going to go back and clean some of those scrapes and abrasions on your face. I'm just going to use a little hydrogen peroxide. They're all superficial, so that's good news. And again, I'll be very gentle, but please do your best to just lie still and relax for me, okay? I'm just going to clean them. This might sting just a little bit, but it will go away immediately. You're probably going to feel tingling more than anything. Just get everything cleaned up. Okay. Most of this is in one area, so that's good. Is this hurting you? No? Good. It's looking good. A little bit more. Alright. And how's that? How's your nose feeling? Feels pretty numb. That's good. I'll get right back to that. And clean this last little scrape right here. It's important to get everything clean more than anything. The body's very good at healing itself, but we just want to make sure nothing gets infected. Alright. That's that. I'm going to go back to the laceration now. And because this area is hairless, I'm just going to use sterile adhesive strips to seal the area, which is a breeze to do. The most difficult thing about treating a laceration is not the wound itself, but the patient's fear of the pain. But I can assure you I'm not going to hurt you, okay? And we've numbed the area, so you can just relax. Breathe nice and deep for me. And I'm just going to gently ease the area together just to make sure it's closed and it is clean. I'm going to apply these little strips, they're like tape, right over the area. Nice and still for me. Alright, and what you do is you apply as many as you need along the line of the laceration, but with little gaps in between. Okay. I'm going to use the second one, and I think 3 will do the trick for you. Just make sure to be nice and still. Keep your face relaxed for me, so that you don't scrunch up your nose or anything like that. Second one, make sure I leave a gap. Okay. It's looking good. How's that feel? No pain? Excellent. Glad to hear it. And number 3. Alright. Nice and still for me. Just breathe. Okay. just do that. Now these will either come off or they can be removed between a week and about 10 days. If they come off sooner, don't worry, it's perfectly fine. All I need you to do is keep them clean and dry, okay? And if you want, you can put a sterile, dry dressing over it. Don't use any cream under that or anything. Just a dressing on top of it to help you keep it clean and dry. But nothing else is really necessary. And between the strips and the gaps where the laceration is exposed, I'm just going to apply a little bit of antibiotic ointment. Okay. I'm just going to dab this on. Nice and easy. A little bit more. Okay. And that looks excellent. I'm going to get another applicator and also put a little bit of this onto the abrasions, just to be safe. And you can apply some more at home if you feel the need, but they should be fine. Just do your best to keep them clean. And they should heal up nicely. Okay. And that's that. Now, if you're having any pain, you can take some acetaminophen every 4 hours to keep that managed. And when you fell, you caught yourself with your left hand, is that right? Okay, you mentioned that. Okay, if I can just see that now, thank you. And these are just some more abrasions. Yeah, alright, well, I'm going to clean these for you. Just relax. Use a little bit more peroxide on these. And these aren't looking too bad at all. Are you actually left-handed? No, that's great. That's odd that you caught yourself with your left hand, but that will be nice so that it doesn't interfere with your writing or anything like that. Yeah, scrapes on the inside of your hand can be annoying. No doubt. Hopefully this isn't stinging too badly. Okay. And this is pretty straightforward. I'm just going to bandage this up for you. I don't think any gauze will be necessary. Just a big bandage and some tape to help you keep it on. Alright, and just let me hold your hand, keep it still. Alright. And I'm just going to put this on, apply the adhesive to the borders of your hand. And I'm going to tape it right here near your thumb so it doesn't come off so easily. No, it should be just fine. Okay, nice and still. Is that comfortable for you? Great. So that takes care of that. You can sit up now if you feel comfortable. Alright. The laceration on your nose will most likely have a little bit of scarring, and you can minimize that by applying some vitamin E or perhaps some aloe. But if you choose to do anything like that, then wait until 2 weeks have passed, okay? Otherwise, keep everything clean and dry as we talked about, and you should be just fine. No problem. Alright, well, you go and try to have a better day, okay? Okay, bye-bye.